This video will outline how to perform a toe pressure assessment. Today I'm using a Hideko ES100V3 Doppler. However, this demonstration is also applicable to the Hideko SmartDop45 Doppler. Lie patient supine with legs at the level of the heart. Ensure the patient is well rested for ideally 10 minutes or a minimum of 5 minutes and is not talking or moving at all during the test. If the patient is unable to lie completely flat, then the toes must be positioned at the level of the heart. Ensure the toe is 20 degrees Celsius or warmer. You can measure this using a temperature probe or infrared temperature gun. Apply a 25mm toe cuff to the base of the toe. The cuff must not be on too tight. It should be in contact with the skin, yet still be able to freely move around the toe. If the cuff is applied too tight, this may occlude the arteries and affect results. Apply the PPG probe to the distal aspect of the toe fat pad using either a Hideko spring clip or paper tape such as micropore. Ensure that the probe has complete contact with the skin so as no external light is being detected by the probe. Turn on the device and ensure that the volume is audible. Wait 5 seconds for a consistent waveform. Carefully inflate the cuff, ensuring not to burst the bladder. Do so by performing half squeezes of the pump until around 200mm of mercury is reached. Wait a few seconds for the signal on the screen to flatline. Begin to deflate the cuff at a rate of no more than 3mm of mercury per second. Focus on both the Doppler screen and the pressure reading on the sphygmomanometer for an obvious visual return of the waveform. You will also notice a significant change in sound frequency when blood flow has returned. Take note of the pressure measurement on the sphygmomanometer when you notice the Doppler first show a return of the waveform signal. In this case, the first obvious signal has returned at 125mm of mercury. Due to possible fluctuations in toe pressures, it is important to test a second time. If second test is within 10mm of mercury difference to the first test, then an average of the two tests can be calculated. If more than 10mm of mercury difference is found, then retest again until consistent results are measured. A measurement of 119mm of mercury was obtained, which is within 10 units difference. Therefore, an average of 122mm of mercury is recorded. Absolute toe pressures are used to help determine healing potential for foot wounds. A toe pressure of above 70mm of mercury indicates that the foot wound will likely have adequate blood supply to heal. On average, the general population will have a toe pressure of 100mm of mercury or higher. Although it is much less common to have calcification of the digital arteries compared to the dorsalis pedis and posterior tibial arteries, it still can occur. This can cause falsely elevated results. If you suspect digital artery calcification to be a factor, then further testing or imaging should be conducted. At pressures between 30 to 50mm of mercury, wound healing potential begins to decline rapidly. For pressures of 30mm of mercury or less, there is a very high chance that a wound will not heal without revascularization intervention. The Toe Brachial Index is a measurement that can be used to screen for peripheral arterial disease. It can be calculated by dividing the toe pressure by the brachial pressure. A TBI above 0.75 indicates that peripheral arterial disease is unlikely, unless calcification of the digital artery has occurred. A TBI below 0.75 suggests that some degree of peripheral arterial disease is likely. If you would like more information, please feel free to contact Brigham Medical.